esophagus, right? So it's kind of hard. And here's the surface epithelium. Here's kind of almost a little, kind of a finger-like villus. It's kind of got this little villus formation on the surface. And then you've got all of this epithelium. It's got these little blue, round, mucin-filled blobs. So do you know what that is? If I told you this is an Alcium blue PAS stain that stains intestinal mucin. So it's Barrett's esophagus, right? So these little blue blobs are the little goblet cells of intestinal metaplasia. So if this is in the tubular esophagus, this then makes this Barrett's esophagus. And when we interpret these, it's kind of crucial because you look for the presence of the Barrett's metaplasia as well as dysplasia. And if a patient has high-grade dysplasia, they're a candidate for esophagectomy these days. So it's a big deal. You know, you have to like have a panel of a consensus to call that. And then the other thing is, see how over here, not everything that stains is necessarily a goblet cell. So it's the morphology of the cells that stain, kind of the quality of the staining, if they're the right shape and size, things like that. So it's kind of a little bit more than just is it blue or not. Okay, so describe the pathology. Is this a neoplasm? No, it's a metaplastic process, right? So metaplastic means you have normal epithelium of some other area occurring in this site. So we would normally see this in the small intestine, but for whatever reason, reflux injury, whatever, we're seeing it here. Can it become neoplastic? Yes, it can become dysplastic. When it becomes dysplastic, that's a precursor for cancer, right, when it gets to high-grade dysplasia. Okay, oops, I accidentally said the answer to metaplasia. Does everybody understand metaplasia? Everybody understands it? Okay. We talked about the epithelium. So in here, it's kind of hard to see, but see all these little red guys, these little red cells? Let's go to a higher power. Yeah. Some of these are stromal cells, but then some of them are not. Some of them are chronic inflammatory cells like lymphocytes. So this is what you see in reflux in this area. You'll see a lot of chronic inflammation. Sometimes you can see acute, but there's a lot of chronic inflammation in here. So we talked about our diagnosis as Barrett's esophagus. We talked about the metaplasia can become dysplastic and go through the dysplasia carcinoma sequence, yeah. Low-grade dysplasia, high-grade dysplasia, carcinoma. And what about signs and symptoms for this? What do you think the presenting symptoms might be with Barrett's esophagus? Anybody have any ideas?
Do you have a lot of GERD?
I'm sorry?
Do you have a lot of gastric reflux?
Right, so 20, I think it's up to 20% of Westerners will reflux. And out of those, a very low percent, 10% will get Barrett's esophagus. And out of that, 10% will actually get dysplasia and go into carcinoma. So it is a low percent, but mostly it's reflux. It's just, the heartburn, the acid reflux, the discomfort, chest pain, sternal pain, things like that. There are patients who present with Barrett's that's advanced to cancer, and they've never complained of anything. And these are usually the elderly. They've had it for so long, they've probably just gotten used to it and just kind of ignore it, or have learned to eat certain foods that don't result in as much reflux and pain for them. So anyways, but the symptoms in general will be those of reflux. Now what would we see? What would the symptoms be on endoscopy? Right, the velvety red, salmon-colored patches or little islands kind of that stand out against the squamous mucosa, the whiter, light pink squamous mucosa. So anytime the endoscopists see that, they biopsy it. Okay. How do you treat these patients? So if reflux causes it, you treat the reflux, right? So you do everything you can to maximize treatment of the reflux. If it advances to these little patches, you of course biopsy it. If they have no dysplasia, you let them go for a year or so, bring them back, see how they're doing. If they have low-grade dysplasia, you bring them back in 6 months. If they have high-grade, they're gonna get treatment of some sort. Yep. So anyways, so you just follow them clinically with endoscopy and biopsy. Oops, I actually talked about the incident. So any questions on this Barrett's esophagus case? Okay, don't get it, it's bad.